So I want to pivot briefly and just hit you with a little bit of data that we've been looking at. And so we use the data biologics platform, which is a great way to advance the level of understanding of what we're doing. Is it really working? And so when I first started doing PRP, and I'd see a patient come back from their rotator cuff and it was a home run, and I was like, wow, this is great. And we keep doing more and more patients, but we really didn't have any objective evidence. Is it working, and who's it working on, and what age and what condition and how long and how many injections? So fortunately with technology, we're really there where there's no excuse not to collect data. It's really cost effective and easy. And what's nice is Softwave has partnered with Data Biologics as they're really critical of collecting data and documenting the efficacy of their product, which I applaud. And so if individuals use the Softwave device, I believe they're allowed to collect data on Softwave and Shockwave, as well as all of their other biologic treatments for at least a year. And there'll be maybe more info on that. But with this registry, we have over 225 providers in the United States, and there's over 23,000 cases documented. And so it was founded by some of my colleagues and close friends that were early pioneers that really advocate for data collection. And I really encourage people to collect data, whether it's this platform or there are others potentially available. And when you look at what we track in terms of different treatments, it's expansive. It's pretty much every type of autologous cell therapy that may be permitted in the United States. It includes shockwave and laser, hyperbarics, hyaluronic acid. We have all the standardized pain scores that are recognized from peer-reviewed journals, and we cover every body part from head to toe, and it includes pretty much the gamut of subspecialties. So I'm not going to overburden you too much with data, but if we look at this slide here, this is interesting. If you remember, we talked about the three different types of shockwave units. You have your broad or true focused, you have your radial pressure wave, or your focused. And so when we look at the data, and again, these ends are slowly growing and becoming more and more consistent, but what we find here is that the radial shockwave can be somewhat beneficial for a few months, but really didn't stand up to the focused and true shockwaves that we see here. And then this is interesting is when you compare the focus shockwave, again, that laser pinpoint type energy compared to more of the broader flashlight bulb energy, you can see here superior pain results of pain scores at 57% reduction from baseline. And so these patients did really well. And what's interesting is the pain reduction persisted and continued and actually got greater here from 51 to 57% at 6 months' time. So we'll be collecting more data as we get more patients enrolled, looking at 12 months, 9 months, etc. But this just shows the difference between the types of devices and machines can affect your outcomes, much like the osteoarthritis study had suggested. And so when you look at some of these patients, we can see this is the energy-only device here on the right, and they had greater reduction in pain scores. Again, this one here is the soft wave or true shockwave and focus, whereas you look at the radial and you can see that they had less benefit in terms of the results. But when we look at biologics plus energy device, we can see there are improvements, but they're just not as robust. And the VAS scores, the pain scores coming into it, interestingly, were even higher at baseline that started with shockwave as opposed to that started with biologics. So we're going to have to tease this out and learn more about it. If anything, it just makes a case, even if you're not doing biologics and PRP in your practice and you're kind of on the fence, you may want to start with shockwave because it's more cost effective and less invasive, and then consider adding in PRP